is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we are pleased to welcome back to the program Dr. Lane Smith. He's a 4-board certified plastic surgeon. Pleasure to have you on the program, sir. And the reason we're having you on the program is that recently a person was arrested in Miami for injecting Fix-A-Flat and mineral oil into a woman's buttocks. The injection site had been sealed with crazy glue. How is this stuff going on?
Yeah, it's surprising to me too. It's going on here in Las Vegas too, and it's very prominent actually in Las Vegas area.
What can be done about this?
Well, several things. I mean, I think that the police and the law enforcement agency are a little separate from the medical boards, and I think if there was a little better combination of those two entities, they might be able to be a little more effective. Some of the organizations that are in charge of policing this sort of thing, it's sort of a gray area. For instance, if you contact the medical board and complain about it, they say, well, we only watch over, physicians. This isn't a physician, so it's not in our jurisdiction, which is interesting. Even though this person may be practicing medicine, there'll be a confusion as to who's in charge of watching over that, and that's a little bit of a gray area that needs to be kind of cleared up.
Is that something that the legislature should be looking at?
Yeah, I do think that they could help define the roles of the various entities slightly, make them slightly more clear, and make it more easy to understand who's in charge of what. I think it tends to fall in a gray area because what they say is, well, it's not a doctor, and it's not, but it's involving medicine, or a type of medicine, an attempt to practice medicine. So it is a little bit of a gray area, and I think that makes it more difficult for the law enforcement agencies to really, find out whose job it is and really go after these problems. Not that they're not doing it; they are doing it, and I think that both the medical board and the law enforcement agencies here in Nevada and Las Vegas are doing a good job. It's just a difficult job to do, and a little help from the legislature might be useful. Another thing that would be good is if these, it's very difficult to get these people to come forward. I mean, right now in Las Vegas, who's doing the buttock injections are the strippers. A lot of the strippers are getting this done in hotel rooms. That's how I found out about it. I got called by a patient. Not a patient of mine, but someone who knew a patient of mine, because she'd had these injections. She'd gotten in an auto accident. In the auto accidents, they did an MRI scan, and they found this, funny material working its way towards her spine. And indeed, she'd been injected twice by someone who flies in from Miami, and probably with free silicone, Fix-A-Flat-like stuff. And those particles slowly get pushed out, or in any direction. They get pushed in or pushed out. They don't stay where they are. The body doesn't like them, so it rejects them. It takes a long time, but slowly it moves. So she was called, she called me in a panic, and then told me the story about how this lady flies down from Miami and injects people every month, and she's injected at least 40 girls, is what she told me.
Well, now, doctor, how does the process actually work? I assume you notified law enforcement when you became aware of this, but how does this underground network and connecting with showgirls and this person that flies in, how do they do this undercover, under the wraps, so to speak?
Well, usually it's the Hispanic population that does it the most, for whatever reason. That population, especially the ones that speak a lot of Spanish, that are mostly Spanish-speaking, that population is a little more close-knit, and things travel in that population by word of mouth. There's a high demand for cosmetic surgery in that population, but they want to do it for a lesser price. As it turns out, actually, this lady from Miami charges almost the same amount that any plastic surgeon does to do actual surgery. But it tends to travel in that community by word of mouth. And usually what happens is, as this patient told me, they'll say to one person, I'll inject your buttocks if you'll bring me 3 more patients. And it kind of goes like that. And so word of mouth gets out in that manner. The things that they inject actually temporarily seem to work very well. I mean, even better than some of the things we do. I mean, they can instantly make the buttocks bigger, rounder, even larger than I can probably make them using surgery. But the problem with the things that they inject, and usually it is a type of non-medical grade silicone, which is illegal and for good reason, is very slowly. Sometimes it can take years. It can take 2, 3, 4, 5 years for the body to force this out, but the body will eventually force it out. So the person they inject it into looks good for a little while. She shows all her friends, you know, and said, well, I had this done, and look at how good I look. And all her friends come in, and what happens is they don't understand that in 2, 3, 4, 5 years, 10 years, they're going to have very, very serious problems. And by the time that happens, you know, this person who's been injecting them just disappears.
All right, Dr. Smith, let's take a break. Let's take a break, and we'll come back, and we'll continue this conversation, which has very serious overtones. We'll be right back on Nevada Newsmakers after this timeout.
Newsmakers with Sam Shad.
And back on Nevada Newsmakers, we continue our conversation with Dr. Lane Smith. He's a certified plastic surgeon.
Dr. Smith, what do you think law enforcement should be doing to try to find these folks and follow this network that obviously exists?
Well, you know, I don't know how to tell them to do their job, quite honestly. I think they're trying hard. What probably needs to happen more is that, you know, some of the people who've had problems with this need to come forward and talk to the law enforcement agency. And one of the things they say to me is, well, you know, we can't do anything unless you give us a specific name or a specific person or a specific complaint. And so I'm not sure what to do. I honestly don't know what to do about it.
Well, one of the things it seems to me is that there's certain, you know, if this is a problem within the stripper community in Las Vegas, and the folks in Northern Nevada might not realize this is a huge industry in Southern Nevada, maybe, you know, an outreach towards those communities, towards those businesses, and to inform the people that come in as contractors and work for them. Because, I mean, this is a serious, I mean, it sounds amusing when you first start talking about it, but there have been 5 deaths due to backroom buttock injections in the recent past, and now this. It is a serious issue.
It's a really serious issue, and even though we haven't seen it, you know, like I said, given 2, 3, 4, 5 years, these girls are going to start to have very serious problems, and they're going to pop up all over the place. I do try to educate my patients, many of which are strippers, about this. And I tell them outright, you know, this is dangerous. Your friends are doing this. Don't do this. Don't get tricked into doing this. Don't get talked into doing this. It may look good temporarily, but don't do it. Sometimes they listen, sometimes they don't.
So public education program you think might be needed?
Well, that's a good idea, yeah. I think that would be a very good idea. Very good idea. Shows like this, you know, thank you for having me and letting me talk about it. This gets out the word too, and helps protect people.
You know, probably about 20 years ago, we started to see a lot of plastic surgery coming out of Brazil, and it worked its way into the United States. Do we have an epidemic of plastic surgery at this time? Is it appropriate? And as we have an aging population, does it become even more appropriate?
Well, you know, it depends on the patient. It depends on the goals. There are definitely people addicted to plastic surgery, but there are also people. I have a letter recently I just received from a patient, and it was just an incredible letter. You know, how she wrote to me how she felt like she had a mutation because one breast had not developed, one had developed very large, how she couldn't wear clothes, how she couldn't wear a swimsuit, how she was embarrassed to go shopping, how she didn't like to exercise in case her little, you know, falsie fell out. And I mean, it was a huge difference, and we were able to correct that. And you know, this is a long letter just telling me how much better she feels about herself. So in the right way, plastic surgery can be extremely beneficial, and in the wrong way, just like everything, you know, can be extremely detrimental. I don't know that there's an epidemic of that in this country. I think there's an epidemic of people trying to do it who aren't trained. I do think there is an epidemic of that.
How many doctors or not doctors do you think are involved in this type of practice?
You know, I don't know. I can't give you a number, but I can tell you that it's a much larger number than you think. I hear about it a lot. And you know, we had these people that were flying here from Colombia. We have this lady that flies from Miami. We have the deaths that were mentioned. There was another death, someone doing silicone injections directly into the penis, and a young man died about a month ago. I think it is more prominent than even I know. Then there are physicians who try to do plastic surgery who are not trained in plastic surgery, and there are nurses who do that. So it's a large number of people trying to do it. There's a high demand. It seems to be a way to make a lot of money, so it attracts people to do it, and it is a big problem. It is a big problem.
Well, Dr. Lane, we really thank you very much for taking all the time to come and talk to us today. It's obviously something that needs a lot more attention, and hopefully this program will help to air that discussion. Thank you so much for being here, and we'll be right back on Nevada Newsmakers after this time out.